I want to talk a little bit about how we can get started. So this can definitely be an issue for people who may not feel as comfortable, or maybe they haven't shared their story a lot of times, and this is the first time they're doing that. So to start off, it's helpful to have a solid plan, a very clear goal, and a strategy of how you want to get there. And our advocacy guide does include a planning tool for you to do that. It's designed to help advocates clarify their vision, to map out a smart and strategic path forward. And it walks you through some questions to help you establish those goals and identify who your audience might be and assess the resources that you might already have or that you might need to make an impact. It also includes advice on how you can reach out to your member of Congress to schedule a meeting. I will share, and this was just my best practice, but I think it translates. If you live in the district of your member of Congress, regardless of whether you voted for them, don't share with them whether you voted for them or not, but they do work for you regardless of that. You can just pick up the phone and ask, who's the person who handles health or women's health? And you can send them an email or try to chat with them on the phone. I would always meet with anyone who was a constituent when they requested a meeting. It was really important to make sure we're hearing the voice of the constituent. So definitely worth giving that a try, but use our tool to plan it out and feel more comfortable in how you're going to approach it. So Erika, I want to bring you in here. As we mentioned, you're the Chief Advocacy Officer with Us Against Alzheimer's, and you're leading a national strategy on advocacy, and you deal with a lot of partnerships and coalitions. We know that 2/3 of people with Alzheimer's disease are women, and women account for a similar proportion of the unpaid Alzheimer's caregiving burden. And so making this area mainstream, if you will, and raising awareness and advocating for this population is incredibly necessary when we think about it in the broader context of women's health and advocacy more broadly. So if you're thinking about someone who's just starting this out, I know we feels like we've all been around for a million years, although every day is a new surprise for us, it feels like. What do you think someone who's in the very early stages of their advocacy journey should be thinking about? And that could be big or small.
Absolutely. And I think the first question is, what is it that you are trying to change? Are you trying to change something in your community for which a mayor or a county council or town commissioners are the decision makers, but then, or are you trying to do something that is at the federal level, whether it's funding for research or working on prevention issues, or maybe it's at in your state capital. But the first thing to figure out is kind of where do you want to make that policy change? And one thing I just love about the society's toolkit, which is so well done, is that it really lays out kind of figuring out who that decision maker is as you go forward. And I've seen, especially among women advocates, how hard they work to prepare all of the details, every single statistic, and really doing their own research. And while I certainly think that that is important for you to understand where and how far that policy problem is, I think what is most important is what was mentioned earlier, which is perfecting your story and making it something that you feel comfortable sharing. Former Congresswoman Lois Capps, who was a nurse from California, one time told a group of my advocates that a compelling story will linger in their minds. And Katie, you just underscored that with your comment that you always remember the stories that they left. And whether you are standing up to testify at a local hearing or if you are coming in to meet with your member of Congress, that compelling story is really what's worth giving the most oomph in terms of your preparation. The other thing that I think you can do is, as you are thinking about getting involved, is to look to see if there is an organization, whether it's a state, national, or local organization that works and is involved in your issue already. And maybe you agree with them and they're doing all of the things that you love after you've had an opportunity to look through their website. Maybe you think that they could do a few things differently, and maybe you think that you could get started with them. The great thing about so many advocacy organizations, and I'll just speak at the national level, is that they often have programs already set up to help you learn to be a more powerful advocate, to hone your story, to perhaps come to Washington with them, to meet with your members of Congress, to be able to really experience what being a powerful advocate is all about, and to get training from them too. And it really helps a lot of advocates with whom I have worked make this be a little less scary because it can be intimidating, even as you remember that these members work for you. And I think that the toolkit is so good, and of course very consistent with the powerful work that the society does as it walks through all of those pieces. And I think that the last thing that I would say is make sure that you feel comfortable doing what you're doing and that you're bringing the passion to this. Is that being met by the organization? Is that being responded to? And there's a fine line between being passionate and kind of crossing the line into a little bit more of an advocate. But I think that one of the great things is that when you bring your passion and your focus, not only do you help with sharing your story and making it the most compelling, but you give so much to the people who do this day in and day out, and you make and remind all of us why we got into the work that we're doing to begin with. And I think that that is something that helps us go even further. I loved every single one of the Hill Days I've ever done. I've loved because at the end of it, in addition to being physically exhausted, I was emotionally and spiritually buoyed. That I had enough reserve in my tanks again to be able to continue to go forward.
Amazing. Thank you. I love that point. I think you're totally right. And you just really, I think, pinpointed it for me, which is those hill days are really exhausting because it's a lot of moving around. It's a lot of logistics. It's back-to-back conversations, but I always feel energized after that. And so I think that's something too that can be really exciting as you think about an advocacy journey.
And it doesn't even have to be on Capitol Hill, right? It could be at your local state house, or it could even be attending a town council meeting. So there's no reason it has to be in Congress to give you that boost and that shot in the arm.
Excellent point.